Did you know that consuming avocados can lead to health issues as serious as a heart attack? Most people only consider the benefits of eating avocados. However, if you have any of the 7 common health conditions covered in our video, of which around 27% of the world's population has one or more, eating avocados may cause serious health problems. Some of these conditions under which you shouldn't eat avocados just might surprise you. First up is those with kidney issues. Avocados are high in potassium, which is normally good, but can be problematic if you have kidney issues. Chronic kidney disease affects around 9.1% of the global population. For those with kidney disease, managing potassium intake is needed because impaired kidneys may not be able to remove excess potassium from the blood. The National Kidney Foundation notes that high potassium levels can lead to dangerous heart complications. Potassium is a vital mineral that helps your nerves function and your muscles contract. It also helps your heartbeat stay regular. However, when your kidneys aren't working properly, they can't remove excess potassium, which builds up in your blood. This can cause hyperkalemia, a condition that can affect your heart rhythm and increase the risk of a heart attack. Avocados contain about 975 milligrams of potassium per fruit, which is quite substantial when compared to many other foods. To put it in perspective, avocados offer more potassium than bananas, a food commonly recognized for its high potassium content. A medium banana contains about 422 milligrams of potassium, making avocados more than twice as rich in potassium for a similar serving size. This high level of potassium makes avocados particularly beneficial for maintaining electrolyte balance, supporting cellular function, and promoting healthy heart function. That's nearly 30% of the daily recommended intake. While this makes avocados a fantastic source of potassium for many, it poses a significant risk for those with kidney disease. Eating too much potassium can be as harmful as not having enough, especially if your kidneys aren't fully functional. For patients with kidney disease, managing nutrient intake is critical due to their kidneys' reduced ability to filter blood. Avocados, rich in potassium, phosphorus, and vitamin K, pose risks if consumed in excess. High potassium levels can lead to heart complications, while excess phosphorus may cause bone and cardiovascular issues. Vitamin K affects blood clotting, potentially complicating the management of blood thinners. Thus, kidney patients must work closely with healthcare providers to adjust their diet, balancing nutritious benefits with the need to control these specific nutrients to maintain overall health and prevent complications. Symptoms of high potassium include muscle weakness, fatigue, and heart disturbances. In extreme cases, it can cause heart failure. So, controlling how much potassium you eat through food is very important for kidney health, especially when it comes to staying away from foods like avocados that are high in potassium. Next, let's talk about heart health, particularly for those with coronary heart disease. Cardiovascular diseases are the leading cause of death globally, affecting millions. In 2019, an estimated 17.9 million people died from cardiovascular diseases, which represent 32% of all global deaths. Avocados contain high levels of fats and calories, which can be a concern if you're watching your fat intake for heart reasons. While they're mostly healthy monounsaturated fats, the calories can add up, potentially affecting weight management, a key factor in heart disease management. Avocados contain monounsaturated fats, beneficial for heart health by lowering LDL cholesterol. However, for those with coronary heart disease, or CHD, moderating total fat intake, even healthy fats, is particularly important due to their calorie density and potential to contribute to overall fat intake, necessitating balanced dietary management. Avocados, though loaded with beneficial monounsaturated fats, also have a considerable calorie load, about 240 calories per avocado. For someone on a heart-healthy diet, particularly those needing to manage their weight or blood cholesterol levels, these calories can be a significant factor. Eating too many high-calorie foods, even healthy ones such as avocados, can lead to weight gain and increased heart strain. It's important to note that while fats in avocados are beneficial in reducing bad LDL cholesterol levels, they must be consumed in moderation. The American Heart Association recommends using them as a substitute for saturated fats rather than adding them on top of your existing fat intake. For those struggling with obesity, every calorie counts. Approximately 2/5 of adults worldwide are considered overweight or obese as of 2016, with higher rates in more affluent countries. Avocados are notably calorie-dense compared to many other fruits. For example, one avocado contains between 200 and 300 calories, which is significantly higher than a medium apple at about 95 calories or a medium banana at around 105 calories. This makes avocados unique as they provide a substantial energy boost relative to their size, a similar calorie content to some small meals. This attribute, while advantageous for high energy needs, requires mindful consumption, especially for those managing calorie intake. For individuals aiming for a calorie deficit, it's important to consider how much of this fruit you consume as part of your daily caloric intake. Obesity is a complex health condition that increases the risk of other diseases, such as type 2 diabetes, heart disease, and certain cancers. Managing weight effectively is important for those with obesity, and controlling caloric intake is a fundamental aspect of any weight loss strategy. Due to their high fat content, avocados are rich in calories, which can quickly add up to additional pounds if not moderated. While the monounsaturated fats in avocados are beneficial for cardiovascular health and can help reduce bad cholesterol, these fats are also energy dense. While fats provide 9 calories per gram, both carbohydrates and proteins provide 4 calories per gram. If the intake of any macronutrient exceeds what the body requires for energy, it will convert the surplus into fat for storage. This means they provide more calories per gram compared to carbohydrates and proteins. When weight management is a priority, it's essential to balance these calorie sources to avoid unintentional weight gain. Avocados are rich in fats, which generally support liver health, but can be a double-edged sword for those with certain liver conditions, such as fatty liver disease. Consuming high amounts of fat can exacerbate liver issues, making it harder for your liver to manage fat processing. Fatty liver disease, especially non-alcoholic fatty liver disease, or NAFLD, is becoming increasingly common, largely due to the rising rates of obesity. This condition involves an accumulation of excess fat in liver cells, not caused by alcohol. For those with NAFLD, managing dietary fat intake is essential, as excessive fat can further impair liver function. Though the fats in avocados are predominantly healthy monounsaturated fats, which can help reduce bad cholesterol levels and control blood sugar, in large quantities these fats still pose risks for liver health. A balanced approach is key in such conditions. Incorporating small amounts of avocado into your diet can still be beneficial due to its nutrient profile, which includes anti-inflammatory properties and other beneficial compounds such as fiber and antioxidants. However, these should be consumed in moderation and as a part of a diet set up to meet low-fat needs to prevent overloading the liver. Moreover, for those with liver issues, it's advisable to discuss any significant dietary changes with a healthcare provider or a dietitian. They can provide guidance based on an individual's specific condition, ensuring that any addition to the diet, including avocados, is safe and health-promoting. The challenge for patients with liver disease isn't just about avoiding unhealthy fats, but also managing healthy fats. Of beneficiaries who use oral anticoagulants, the proportion using DOACs increased from 7.4% in 2011 to 66.8% in 2019, with an increase in DOAC users from 0.2 million to 3.5 million. If you're on anticoagulants, also known as blood thinners, listen up. Vitamin K, which is abundant in avocados, can interfere with these medications, affecting their efficiency. It's important to maintain consistent vitamin K intake when on these drugs. Anticoagulants, such as warfarin, are prescribed to prevent blood clots, strokes, and other serious cardiovascular issues. These medications work by inhibiting vitamin K, which is important for blood clotting. Therefore, fluctuations in dietary vitamin K can lead to significant changes in how these drugs work, potentially making them less effective or increasing the risk of bleeding. The amount of vitamin K in avocados, about 21 micrograms per half fruit, may seem small, but it is significant when compared to daily vitamin K requirements and the content in other common foods. The recommended daily allowance, or RDA, for vitamin K varies by age and gender, but generally, adults need approximately 90 to 120 micrograms per day. This means that consuming just 1/2 of an avocado provides about 18% to 23% of the daily requirement for vitamin K. Patients taking blood thinners are often advised to keep their vitamin K intake stable to prevent interfering with the effectiveness of their medication. Sudden increases in vitamin K can counteract the effects of anticoagulants, leading to health risks. Gallbladder problems. They are common in wealthy countries, affecting 10% to 15% of adults. For those with gallbladder problems, high-fat foods like avocados can trigger gallbladder attacks. Symptoms include pain, nausea, and vomiting. It's of utmost importance to moderate fat intake if your gallbladder is compromised. The gallbladder's primary function is to store bile, a substance produced by the liver that helps digest fats. When you eat a high-fat meal, the gallbladder releases bile to aid in digestion. However, for individuals with gallbladder issues such as gallstones or cholecystitis, which is inflammation of the gallbladder, consuming high-fat foods can lead to severe discomfort and serious complications. Avocados, while rich in healthy monounsaturated fats, are still high in total fat content, about 22 grams per avocado. For someone with a sensitive gallbladder, this amount of fat can be enough to provoke a gallbladder attack, which is not only painful but may also require medical attention. It's important for those with gallbladder conditions to follow a low-fat diet to minimize symptoms and avoid triggering an attack. This includes being cautious with foods that are generally considered healthy but are high in fats, like avocados. Opting for smaller portions or substituting avocados with lower fat options can be beneficial strategies. Lastly, pancreatitis. In the U.S., acute pancreatitis leads to 275,000 hospital stays per year. About 20% of these cases are considered severe. This condition requires a low-fat diet to manage symptoms effectively. Since avocados are high in fat, they might increase the risk of a pancreatitis flare-up, leading to severe abdominal pain and other serious symptoms. Pancreatitis involves inflammation of the pancreas, which can be acute or chronic. During episodes of pancreatitis, the pancreas becomes inflamed and the digestive enzymes it produces can begin to digest the pancreas itself, causing intense pain and potentially serious complications. A key component of managing the condition is dietary control, specifically limiting fat intake to reduce the workload on the pancreas. Despite their health benefits, avocados are high in fat, predominantly healthy monounsaturated fats. However, for someone with pancreatitis, even healthy fats need to be consumed with caution. Managing fat intake doesn't just involve avoiding obvious sources like fried foods or butter. It also means being mindful of hidden fats in otherwise healthy foods like nuts, oils, and avocados. Individuals with pancreatitis must work with their healthcare providers to develop a diet plan that limits these foods and closely monitor their symptoms. Patients are often advised to eat small, frequent meals that are low in fat and easy to digest to minimize the strain on the pancreas. This approach helps manage pain and other symptoms associated with pancreatitis while supporting overall digestive health. Ultimately, educating yourself about what foods to avoid and how to substitute high-fat ingredients with lower-fat alternatives is essential for living with pancreatitis. While avocados are beneficial for many, if you have any of these 7 health issues, it might be best to consult with your healthcare provider before including them in your diet. Did any of these surprise you? Let us know in the comments below if you have any thoughts or questions about today's topic. Don't forget to like, subscribe, and share this video to help spread the word. Stay healthy and see you in the next one.